Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.
I'm Dr. Melanie Rosenblatt, and you're watching Live Pain-Free.
Well, I did my residency training at Georgetown University in neurology, and then subsequently I did a dedicated fellowship in MRI and CT where I read brain and spine MRIs. So that's really all I did. So I did a fellowship, and then subsequently, when I came down here in 2000, I started working with my father. I'm in practice with my father. And basically what we do is that we evaluate patients with neurological disorders, and I also read MRIs and CTs of the brain and spine. So part of my practice is seeing and taking care of patients, and the other part of my practice is interpreting MRIs and CTs. And the reason that it's important for me to visualize the pathologies that we look for on MRI and CT of the brain and spine is because it's important for me to be able to take care of patient in the best way that I can, and it helps me to help minimize their pain, to treat their pain, and to treat the various disorders that we treat as neurologists.
Now, we know that there are a lot of neurological issues. Everybody, the nerves are the most complicated, the brain and the spine, the nerves are the most complicated system in the entire body, and that's your field. So that's where the pain emanates, one way or the other. What's pressing on the nerves, what's bothering the nerves, what's affecting the brain. Can you share a little bit about where pain usually kind of starts from, whether it's from the spine or from the brain or from where we get pain, and how we should deal with that, and when somebody should come see you?
Okay, well, there are many different causes of pain. So the brain is the part that obviously perceives pain, and that's actually, we target some of the pain treatments with medications that are not narcotics that basically help what we call, they're called pain modulating medications. So they try to help the brain deal with the pain. And then pain originates all the way from the peripheral nerves, and the longest nerves in the body, in the hands and the feet. And then a lot of people, most of the people that I have, that I see and evaluate for pain, it comes from the spine. So they have disc problems, spurs that grow on the bones, that press on the nerves. They have what's called spinal stenosis, and stenosis just means narrowing. And basically what happens is that the spinal canal narrows, and it pinches the nerves and the spinal cord, and that can cause pain.
Thanks for being on our show, and keep up the good work.
Well, thank you. I appreciate you having me.
Oh, we're so glad to have you.
Be here. Thank you.
Thanks.
Okay, so here we obviously have a model of the spine, and so I'm going to discuss some of the things that are important about it anatomically and how we use imaging to look for exactly which nerves are pinched and how bad they are. So basically, when we image the spine, we image it in a bunch of different ways. So just to orient you, basically this is the neck, so this is the cervical spine, this is the mid-back, the thoracic spine, and this is the low back, the lumbar spine. And basically these are the bones, the vertebral bodies, and in between are the discs, which act as cushions. So down here, for example, we have a disc, and basically this is where the nerves come out, right here, these are called foramina, or this is where the nerves exit the spine. And for example, we have a disc herniation here, and you can see how when it's coming out like this, it can pinch or irritate the nerve. And this is an example of how people develop leg pain, and this is part of the practice of neurology and spine, that we deal with people that have disc problems that affect the nerves.
Did you hurt yourself playing golf, tennis, or other activities? Chronic pain? Call 561-600-HURT. Live pain-free. Call today.